Hi, I'm Lisa Gorman from 360 Neuromuscular Therapy, and today I wanted to show you how to treat hips on the floor. I know we have a video with Sarah using the wall as a way to do self-treatment for your hips. So once that isn't really helping much or you're not getting enough out of it, then you're ready for the floor. And I'm going to also show you how to use both the double tennis ball and the single tennis ball. So remember our travel kit, you have no excuses to not do self-care when you're traveling. So first we'll do the single, and you want to use your same guidelines that you do when you're in session with your 360 NMT therapist. 10 is the greatest pain you've ever experienced, so you want to stay around a 5 or so, 5, 6-ish, which I know we do a little bit more intensity in treatment, but when you're by yourself, you don't need to push it, like you don't need to try to kill yourself. It's fine. And if it's too much, just move on. Don't hang out someplace and like be in a ton of pain. It's not worth it. Totally not worth it. It's supposed to make you feel better, not worse. So I like this position when I'm doing my hips on the floor. I feel like it's more stable and it's easier for me to remember which hip I'm treating. The knee that's down is the hip I'm treating. So you just place that first bony landmarks. You find your gradient trochanter. It's pretty much right where your leg is coming in, and you just move your knee up and down, and you can feel it come up right into your fingers, and then your iliac crest, just right there. Also, sits bone, right here. Really easy to find. You feel it when you're sitting, right? So those are the landmarks that we're kind of staying between. It's really pretty basic. You just gently move yourself, find something, move around. I'm doing this significantly faster than I would if I was actually treating myself. But you just go until you find something that's tender, and you can really control how much weight you're putting on the tennis ball in this position. I find it really easy. So, and if you find something that's tender, hang out just like against the wall, right? You hang out for 10, 15-ish seconds. If it doesn't feel like it's getting better, all you have to do is lift and drop your knee. So easy, right? Do that for, I usually just count and do like 10 of them. And then hang out again for another 10, 15 seconds to see if it goes away. If not, you don't want to really hang out anymore. Maybe just move a little bit. It might hurt more. You might not be exactly on it. You got to kind of play with it a little bit. Then when you get to so you just want to work your way around. To get into the more lateral fibers, you just keeping your spines, to keep your spine safe, you just get on your elbow. And now my leg is completely on the floor. And just kind of, you can control your weight by just kind of lifting up and off or sinking down onto the tennis ball. And that's single tennis ball, hip treatment on the floor. The double is pretty much exactly the same. Do the other side as to not over treat. Same thing, bony landmarks, find them, so know you're going in between them all. Because it does not feel good to treat bony landmarks, it doesn't. So the difference between the double tennis ball and the single is with the double, you actually have to like move yourself. You can't just roll around on it. So it's a little bit more time consuming sometimes, but what I love the double tennis ball for on hips is to get these the very lateral stuff. That is where the double, I always find stuff. Yeah, see, it's already, and it's referring. So if you get referrals like you do in treatment, don't panic, it's fine. And again, that's when you want to do the movements, just like we do when you're in treatment at 360. So just doing a little lift and drop of the knee. Hang out a little longer. Sometimes it'll sink in more and you'll feel more, it'll increase, but you just work with your body, don't fight it. And that is how you do hips on the floor, single and double tennis ball. I hope you feel confident that you can do this on your own. Thank you so very much, and we hope to see you soon.